I heard of the CalAIM program through a friend of mine at Kaiser, and I was excited. And I was excited because we've been taking care of patients on the private pay side for so long. Our company, Comfort Keepers, has been in business for over 21 years. We do personal care, respite care, and take care of people in their homes. And sometimes we provide sitter service, like in hospitals and things like that too. But um, for the most part, it's been private pay, with the exception of, maybe working with Jewish Family Service or PACE. It's been private pay, which has meant that there's a lot of people that have not had access to this kind of in-home care support. When CalAIM came along, it was just this breath of fresh air, because when you pick up that phone and you hear somebody's story about how they're living and what help they need, and we call our clients cutie patooties, the little elderly person or whatnot on the other end of the phone, when they're telling us, honey, I have some needs. I can't make my own dinner, or I can't do this and I can't do that. And they said, but I'm on Social Security and I just need to know how much your services are. And then right there is when, unfortunately, the conversation historically would stop, because we would have to redirect them to IHSS, and that could take a lot of time. So to find out that this amazing program was put together to take care of just those people, it brought tears to our eyes. We were, as a company, overwhelmed and proud and joyous. I mean, we were sharing it with everyone all the time. Fast forward, we got approved with the state, and then we, started working with different organizations that were getting people signed up for this type of care. And then all of a sudden, we're able to start helping people and telling them on the phone, we have a solution for you now. We have a solution for you, helping them fill out the paperwork with Kaiser, or filling it out with Blue Shield, or, group health. Like, just being able to go down that road and give people guidance and support that they didn't have before was a great feeling. 4 months ago, we got a call and we were asked to go and check on somebody that needed support. And our process is a little bit different than other people by way of community supports. Yes, we provide the personal care and the respite care, but also we go out and physically meet with everybody that we're bringing on for care. And we do that for two reasons. One, we want to meet the people in person and not just take over the phone what their story is. You have to see them. You have to know what their physical condition is. You need to know what their home life is like. You need to know the environment, the people that are there, all of those things, for a lot of reasons. One, for safety. Two, to make sure that we're sending our caregivers to a safe environment. And three, to make sure that there's not something else going on with that individual that can't just be overlooked through a phone call. So we recognized immediately that we were a little bit different in that way, because we were going out to see everybody. And in a particular case, we had someone call that it was Blue Shield, I believe, that asked us to go check on someone, do an assessment, and then let them know what we thought. And when we got out there, this gentleman was overwhelmingly grateful. And he was grateful because he was suicidal. And he had said that he kept trying and trying and trying and trying to get help, and there wasn't help. We happened to be there at the perfect time to make the call to the original social worker that put in the order for him to be able to get this community support help, and to get on the phone with that individual and connect him and say, actually, you do have help now. That's why we're here. That's why your social worker made this recommendation for you. And right then and there, we were able to also help him get ECM support by having a further conversation with this social worker. It was divine intervention, call it whatever you want, but we were there at the right time and able to connect all of the dots. In addition to that, a part of our process is what's called a home safety assessment. So we do that for all of our clients. We go through and make sure that there's no rugs, there's no issues that'll cause them trip hazards. But in addition to that, we make sure that, do they have food? Is it expired? Things like that. And we looked, and this poor gentleman, not only did he have so many physical issues going on and some clear, mental health struggles that he was going through, but some of his most basic needs weren't being met, like food. The shelter that he had, unfortunately, was in an environment that caused him to have elevated issues with allergies. One thing after another was stacking up against him. And I can see why that loneliness and that despair set in. And he felt like he was a burden on the system. He felt like he was a burden to us. He felt like that he was a burden to his social worker. And to feel like the only option is to just not be here anymore, that's not okay. That's
Right.
not okay. And I personally believe that's why this program was created, because there's so many of those people out there that have just not had our help, anyone's help for that matter, not because we don't care as a community, as a state, but you don't know what you don't know. And you don't know even more if you don't go out and visit people, which is why the ECM program, by the way, is just absolutely phenomenal. But we were able to look in his fridge and find out that everything was so old that he would have been sick had he have eaten any of it, like weeks, months, and in some cases years old. So we find out that he has an EBT card that he didn't know how to use. We were able to get somebody to come over and provide some support for him, get on the phone, talk to ECM, talk to social work, go buy groceries, and provide enough food for him while his approval for community supports was being processed. It was that day that I knew no matter what happens, we have to tell everybody and anybody that will listen, this program is a must. It is so important for us to reach out and do the things that we have never done before for people that are in need. And who cares if they don't have the financial means to pay privately? There are now organizations that are stepping up, like Kaiser, like Blue Shield, all of these people coming forward and saying, hey, you're not alone anymore. And I mean, for us to see, feel, and touch those experiences, and we had another client recently that was had cancer, and she was totally and completely by herself, and having family members that have gone through that and gone through chemo. I can't even begin to imagine what that's like to have transportation take you to and from cancer treatments, but not to have somebody to make sure that you have something to drink, to make sure that when you're nauseous, someone's making calls for you to get you help picking up your prescriptions, like basic things that we all take for granted that are a part of our everyday life that the underserved populations have just not had access to. It makes what I do now so much more important. Yes, being a service provider for those that are private pay, I'm happy to help anybody that wants our help. Happy, proud, and will continue to do so. But to be able to do so for those that can't pay privately,
Yep.
you can't ask for a better feeling. You really can't. Moving into this space now and making flyers and going out and telling the world, we're telling everybody, every hospital that we go into, whether it's Scripps or Kaiser or Sharp, we're teaching care managers, we're teaching physicians how to use their own forms, because if they all know, and the more word that we can get out, the more people have access and the better off we all are, the less of a drain on the hospital systems, the less weight people have sitting 8 hours in an ER when that's not necessarily what they needed. Everything about this has just been eye-opening, and it's brought me a sense of peace and gratitude that honestly I haven't had in 20 years. Surprisingly, we've had two different reactions. One has been, is this real? It
Yeah.
seems too good to be true. How could your
Sure.
care really be, no cost to us? And
Hmm.
you can thank all of the advocates that have put this program together. You can thank your health plan because
Hmm.
they had to participate in order to be a part of this program. So people really did think this is too good to be true. But then shortly after, there's that call that they make right to their provider and go, hey, this company is calling me and telling me that they were approved to come and provide care. Is this real? And then finding out that it's real, then you see a sense of gratitude, a sense
Hmm.
of peace. A couple of people resistant, I think, in general, just because that's just how human beings are sometimes, not wanting help. used to being alone for so long that it's hard to accept help. But by and by, I think in large, it's been the gratitude that you don't have to try to fight this battle, whatever battle it is that you're fighting alone. How many people there are that need help.
Yeah.
I think that sometimes we just go about our day-to-day life and you don't really realize how many people need that help. I stopped and thought about it. Could I personally, if I needed the kind of care that would be required if I had something like cancer or some kind of, physical or mental issue, how much care could I afford? Myself. Unfortunately, with things being as much as they are for a whole lot of different reasons, right? Whether it's the cost of insurance, the cost of doing business in general is a lot higher than I think people realize. But that being said, to know that it could happen to anyone and to know that there is now a solution, it feels good. And I hope that it's something that is adopted and is an ongoing plan. I understand that it's, definitely a pilot program, and I hope that what comes from this is true adoption, because it's going to change people's lives permanently, and it's going to change the way that the hospitals have to flow with so many people coming in unnecessarily. Had they have just had that preventative support, they wouldn't have landed in a dangerous situation that gets them in the ER. And also the surprises from all of this. I really didn't see this coming. And to those like you and your team that have been working to put this together behind the scenes, I'm extremely grateful. So because
Okay.
we go out and we do the assessment and determine what their needs are, it can vary from a couple of hours in the morning or a couple of hours twice a day, or it can go all the way up to 6 to 8 hours a day for a short period of time. It really just depends on what their needs are. And that's why the hands-on assessment is so important, because somebody can make a recommendation. Oh, this person's fine. They only need, 2 hours in the morning, 2 hours in the afternoon. But if you don't have eyes on them and you can't, tell what's going on, when we show up and we find out somebody's bedbound, whoa, that person can't be left alone. That's not somebody that is, okay with 2 hours in the morning and 2 hours in the afternoon. There needs to be some additional community supports that are brought in. And
Mhm.
that's given us the opportunity to be an additional voice for that person that may not even know what else they need. Had the opportunity to provide the home modifications as well,
Mhm.
just to create a physically safe environment in addition to the caring environment it's all been fantastic. You see someone go outside and get to go to the garden for the first time in years, and that was their life, was to go to I can't even tell you what that looks like and what that feels. Some people have come and then they've exhausted what their approved hours are, and then there's been an extension request put in, and then that goes to the provider to approve or deny. And for the most part, especially if there's somebody that has been, has had a physical or, mental health need, and they're still waiting for IHSS support, then I haven't seen any issues or delays with the extensions at all. And that's just been a huge blessing for everybody, because we're not having to go, I know you got used to this and I'm really sorry we have to leave you this way now. And we haven't had to do that. And that feels really, really good. I feel like the health plans, especially Blue Shield and Kaiser, are doing an excellent job at following up and making sure that if an extension is needed, that that person is getting it until their IHSS comes through for them. And the
Okay.
community support side of things, to be able to do the home modifications, like it's something so small, but now that person
Mhm.
can get up and use the restroom independently. It's so
Yeah.
liberating. You're giving such a big part of their life back to them. Or somebody to go do your grocery shopping for you, or to even download an app and show you how to do it yourself and give you that access, or just to change the settings on your phone to give you a bigger font so you could see. All of those little things people don't
Yeah.
realize are just life changers. and to be able to take a shower maybe safely because somebody is standing by. That's just, it seems so basic, right, for you and I, but for somebody that hasn't been able to shower in 2 weeks or 3 weeks. And that's where the gratitude comes in. And you see these smiles, and to help somebody make a phone call to a loved one, or for a loved one to be in another state and to be able to have FaceTime with our caregivers so they could see their loved one. We were quick to get in line and to sign up because it's what we do already. We've been doing it for 25 years. As a whole, Comfort Keepers has been in business. We're a franchise system. We're all independently owned and operated, but we cover all of California state. And for us to be able to do this and now expand our reach, you just can't ask for better than that.